Hello and welcome to Module 7 on the LNEC series. In this module, we are going to be talking about loss, grief, and bereavement. And these concepts are deeply ingrained throughout every aspect of palliative hospice and end-of-life care, both to the family and to the patient. Throughout these videos, we're going to be talking about different types of grief and recognizing and distinguishing between those, as well as describing different tasks and factors of grief. We're going to look at interventions that may be appropriate to facilitate normal grief. We're going to talk about death awareness and cumulative loss. We're also going to talk about identifying systems of support for the nurse to assist in coping, both the family and the patient. And looking at the NCP guidelines, again, these all are, throughout this entire course, we're talking about evidence-based practice as much as we can, as much as the research that is available allows us. So here we're talking about domain 3 and 7, talking about physiological and psychiatric aspects of care, as well as care of the patient nearing end of life. So again, it says sound familiar because this course is created for for practicing nurses. So while this doesn't sound familiar, it will become familiar to you. So here's some few examples of different types of grief that patients are going to experience. So Susan is a single mom. Her only son was killed in a motorcycle accident. Joshua and Heather, their 21-year-old daughter, committed suicide. Martin, partner, died of a heart attack. William, wife of 60 years, died from complication of diabetes. So these are different types of loss. These losses are experienced at different time frames throughout the lifespan. All of these are going to have their own unique experiences with grief. So you are going to witness death, you are going to witness loss, you're going to witness grief. And this can really, really weigh on an individual. We are a social species and it affects us to see others suffering. So it's really important as you do witness these losses, this grief, these deaths, that you remember to take care of yourself as well. Let's define what we're talking about. So loss is the absence of an object, possession, ability, attribute, something to that nature. The value of that which is lost is unique to and defined by the individual experiencing the loss, meaning that each loss is unique to every individual. Grief is the emotional expression and reaction to a loss. Bereavement is a period of grief and mourning. So grief is that emotional reaction. Mourning is the outward expression. So mourning is really, it is deeply impacted by upbringing, background, society, culture, gender. Each person expresses grief in ways that they learn to and ways that they learned not to as well. So bereavement is that period or that grief and mourning combined. And remember, just because someone does not appear sad, just because they're not crying, just because they're not expressing grief as you would expect them to, does not mean they are not grieving. So we can never assume that someone is not grieving. Each person is going to grieve in their own way. So patients grieve in their own way, families grieve in their own way, nurses, healthcare professionals, physicians, everyone grieves in their own way. It's important to address this grief using that interdisciplinary approach because everyone brings their own specialty. While the nurse is the most connected and present with the patient, the nurse needs the support of the IDT team in order to really provide that holistic care to address all of the needs of the patient. So illness is incredibly inconvenient. It is very disruptive, and in that inconvenience and disruption, there are different forms and aspects of loss. So an interruption to a patient's life, that's a loss of routine, a loss of daily activity, perhaps a loss of functionality, a loss of independence, a loss of role, even a loss of identity can occur during that. Family life is interrupted, especially if it's a young parent or a child that is the one that is dying or terminally ill. Even an older adult perhaps is cared for by a child or a grandchild. It's very disruptive to that life and that family process. And within that disruption, there are multiple micro losses occurring. So maybe it's a loss of sleep, maybe it's a loss of free time, maybe it's a loss of finances. There's just all of these losses that occur and impact the patient's social well-being. It may promote isolation. People may feel very alone in their loss. People may be alone in their loss. And often dreams and hopes for the future are completely disrupted. They're not going to come to pass. It doesn't matter at what point along the life spectrum loss occurs, there are going to be hopes and dreams that are disrupted. Humans, in addition to being social creatures, they are very much meaning-seeking beings. Everything, we look for the meaning in it. Nurses are committed to preventing suffering, but so many times what patients are seeking to find is really the meaning in the illness, the meaning in their suffering. And often their suffering is creating one of the greatest challenges that they've ever experienced, and so that's another reason they're trying to uncover the meaning behind it. This can be seen through physical and emotional pain. It can be seen through spiritual distress, anticipatory grieving. Patients, they're commonly seen as broken, both physically and spiritually, and this brokenness, it allows their souls to cry and ask this existential question of why. Though often the answer is not going to come. The answer to that why is this happening to me, is not going to come. And so in seeking that why and seeking to understand, that's looking for that meaning. So the role of the nurse is really to respect the patient's suffering and their attempts to make sense of their illness. It allows you as a nurse to provide opportunities for telling, allowing the patient to share their story. A lot of people, as they're looking for meaning in their illness or in their life, they just want to share their life experience with somebody. And so as the nurse, you can listen to that. It's vital for the nurse to be present and attend to these patients, because if the nurse is obligated, right in the Code of Ethics, the ANA Code of Ethics, the nurse is obligated to address and alleviate suffering and providing supportive care to the dying. So this existential crisis that many experience is part of the ethical responsibility of the nurse. Another huge loss is the loss of sexuality and sexual intimacy, or even just intimacy when there is serious illness present. This is something that a lot of patients don't talk about, a lot of caregivers don't talk about, and a lot of healthcare providers don't address. So throughout serious illness, there's different stages that affect both sexuality and sexual functioning. Yet sexuality is very rarely ever considered a medical concern, so it's not addressed. But think about the need for connectedness, especially in a partnership. That intimacy, that sexuality is a way to be connected, and to have that removed, often involuntarily, if there's an illness present, that loss, that's going to cause its own type of grief and its own type of isolation. So that as patients get sicker and sicker as well, they become more fatigued, they lack desire, physical symptoms may prevent traditional sexual expression as well. There may be surgical sites, there may be an ostomy, there may be urostomies, there may be wounds. There was one study looking at 65 patients admitted to an acute care and palliative care unit, and of those 65 patients, 86% said that sexuality was so important to them that they wanted to talk about it with a knowledgeable clinician. Like that was something that was in the forefront of their mind. So unfortunately it's not being addressed. So there are ways that we can, as a nurse, bring it up for the patient, because in addition to it not being addressed, it's often embarrassing to talk about. It can be considered a social taboo. So just ask, how has your illness affected your sexuality or your intimacy? And that allows the patient the opportunity to bring up their concerns. Maybe they have no concerns, but more than likely they are going to have concerns, because remember, 86% of the patients in that population wanted to address sexuality. Ways to allow for intimacy, it's really hard in a hospital setting. It's really, really hard. So allow time for privacy, like build that into the patient's care plan. This can be things like closing the curtain, saying no one is going to come in here unless you request us to for the next hour, and then putting a sign on the door, communicating with the team. Just giving that quiet, alone time for partners to be with each other. Simple things like encouraging the partner to lie in bed with their loved one, allowing the partner to help in the care, especially things like bathing, applying lotion, anything to encourage touch and that physical connection, are ways that you can build intimacy into the experience and really begin to address that, a lot of those, the things that are missing. So this is, if you would like to read this, there's after this gentleman, after his 34-year-old wife died, he wrote about how the nurses allowed him to be intimate with his wife and just gave him that privacy and allowed for that emotional connection before she died. It's really a sweet story. I will let you read it on your own if you so choose. This as well is a really, really great video, so I encourage you to watch it. It talks about, they call them Gen Silent, LGBTQA plus communities as they age. So much of their life together has been secret, and even if they don't have to be secret anymore, having older couples in a homosexual relationship or a non-traditional relationship, it doesn't fit in still in that generation, in that community. And so this really brings to light some of the issues that this community faces, and it's really important to consider as you're caring for these patients. We've already discussed the different physical and emotional and social needs of the patient. So those are the basic needs near the end of life. Other things, elimination, nourishment, those have been addressed as well, but companionship is really important, especially in partnerships, and recognition of the continued existence. So many patients they really want someone to bear witness to their pain. They want to know that someone will listen to their stories, that someone will remember the story of their passing. So it's a unique way that the nurse can meet the need of the patient by bearing witness to their loss, to their grief, and to their story. Some final thoughts in wrapping up this first video. It's really important for nurses to understand how patients and families comprehend loss. So in order to better understand loss and grief, as well as bereavement, nurses really need to be willing and committed to spending time with the families, to hearing the stories, to being present, to bearing witness. Remember, we can't fix everything. We're not going to completely eliminate the pain. We're not going to completely eliminate the nausea, the vomiting, the insomnia. But what we can do is bear witness. And this is a difficult part of what we do, but it's so necessary. And nurses are such an excellent role model in bearing witness and being the example on the interdisciplinary team. So understand how patients comprehend their loss, bear witness, and address the grief.